Hey everyone, Dr. Kriti Mohan here. Today I want to take you through a patient experience with breast augmentation here at Ciaravino Total Beauty. This is a first-hand look at her whole experience from start to finish, so come along and follow up with us.
I'm here at my pre-op appointment today. I'm super excited. The main thing I really want to ask Dr. Mohan is about the sizing. I did show her some inspiration pics, and what I want to make sure is just what my vision is I can actually complete with my body style, because I know every person has their own body shape and their own anatomy, and Dr. Mohan made sure to really explain that to me. So that is the main thing I really want to nail down today, but I'm really excited for my appointment.
That visit is a great opportunity to sit and go through all of your pre and post-operative instructions and medications and get ready for surgery. And then I get to come in and talk about sizing one last time.
I'm currently waiting for Dr. Mohan to come in. I have some inspiration pictures I want to show her. What I'm really looking for is just something fuller, more perfect, and just something not too high and not something up to my chin. I just want something more natural. So I'm excited to share that with her and look for the next steps.
Hey, Miss Ashley, are you ready?
Yes, I'm so ready.
Nice to see you again.
Nice to see you.
Okay, so today is easy. I know Mackenzie, of course, went through everything with your little packet. Any questions about any of the instructions?
No, I think I've got everything.
Okay, perfect. Really what I just want to look at is, we talked about obviously anatomy.
Mm-hmm.
So, I personally think like your breasts are pretty symmetric. Like maybe one, you can see they sit a little bit lower.
Right.
But I kind of feel like we shouldn't do two different sizes.
Okay.
You can see the cleavage is going to be awesome.
Yeah.
So that's at 375, and I personally feel like this is where it's gonna sit.
Yeah.
So that's where it's gonna fill out really nicely.
Is that how far out they're gonna be?
Yeah, but it's gonna be underneath all of this.
Yeah.
So it's not gonna
bit.
be like you're like way stuck out this way, because all of this, is kind of air that you won't see, so it'll be underneath everything. Okay, and then I always ask for inspiration because we looked at your consult, so we have some more
I've got
photos.
one ready.
Okay.
So this is one of them. I just like how just round and full they are, and they're not too high up, but they're still like perky and cute.
I agree.
And they're not too wide and not too, I guess you'd say, saggy or anything.
Yeah, and I think this is kind of what we talked about for the boost, so that'll be great.
Exactly. That's exactly what I was thinking.
Perfect.
It's surgery day, and I am so excited. I have no nerves. I'm going into this just super confident and excited. I've got all my stuff. I got my medications, the surgical bra, everything that they gave me. So I am prepared, and I am ready to go into this with just super open. Good, I'm excited. Oh yes.
Day of surgery is here. I love this visit because it's the last time I get to see a patient before surgery, get to calm their nerves, see whatever final questions they have, and confirm sizing and marking one last time.
I'm all ready and dressed for surgery, so we're just minutes away from going back. I'm feeling really excited. I'm not nervous really at all because I've waited so long for this. But really, we're about to just do our markings and make sure and triple check that the sizing is what I want and aligns with my inspiration pictures that I previously showed her. But overall, I'm just excited.
Hey, Miss Ashley, are you ready?
Yes,
surgery
I'm so
day.
ready. Oh, yes.
Okay, so any questions about surgery at all?
No.
Okay, we're gonna do marks. So I'm gonna have you stand right over here, and then I'm gonna do some markings on you, okay? And our goals are still the same. We wanna go up to that nice D cup. Okay, perfect. Did you get a good night's sleep?
Oh, yeah. I slept good. I'm like, no nerves at all. Do you want this one too?
This is totally fine. You can just hold it right there. I'm just gonna mark your tiny little incisions over here. And these are all from the fat grafting, right? Those little poke holes in there. We'll plan on 375. You feeling like any way about the size? I feel like when we talked about it before, you didn't really want to go down because I thought that would be too small. After I mark our patients, that's when we get to start the whole surgery process. Our practice is so unique because every patient gets to meet with our anesthesiologist in person the day of, and then we have this massive team of OR staff that all work together so well to get everything ready for surgery, making sure that it's the safest place and experience for patients. Then we start surgery with our famed Ciaravino method. This is what makes our practice so special in that it starts with perfect selection of implants before surgery, and then in the procedure itself, we have less than 1-inch incisions for our breast augmentation patients, and then we use a no-touch technique with a funnel, which means that we are never manipulating that implant, allowing for less scar tissue formation and a much safer result. The patients also have an atraumatic surgical technique, which allows them to have an even faster, safer, and more consistent recovery. I always sit our patients up as well during surgery. This is so crucial to make sure that our results are perfect. I love to ensure that we have symmetry noticed beforehand so that we can make sure that this is the case after. Hey Killian, it's Dr. Mohan, how are you? All good, Miss Ashley's all done, everything went perfect, no problems. We did the 375 like planned and she looks great. After surgery, our patients recover in our state-of-the-art surgery facility with our board-certified nurses, and we make sure that they're able to wake up and are ready to go home.
Hey, I'm at my 1-week post-op. I'm feeling good. I'm getting adjusted. I would have to say like the first 2 days after were pretty rough, but now I'm starting to get used to things, getting used to brushing my teeth and putting my hair up. But I'm excited to go in, and I just have a couple questions following the procedure and kind of where they're at now.
At this visit, we are checking the implants, making sure you're looking okay, but we're also extremely hands-on to make sure that we're teaching you how to massage your implants, also how to remove your surgical tapes so that we educate you on all the scar therapy you're going to be doing after this. This is all so important to ensure that you not only have beautiful settled results, but also perfectly healed scars.
Hey, hi, you look so cute.
Oh, thank you. How are you feeling?
Good, actually.
Yeah? Okay,
Yeah.
well, I know Mackenzie went through everything with you,
Yes.
so are you feeling better than last week?
Oh yeah, I think
All
the
the
first 2
tightness?
days were rough, but
Yeah.
after that I was like, it's a breeze.
Okay, good. Let me
Yeah.
take a peek at you. Ooh, they look good. Okay, at this stage, I always tell you, like we were chatting,
Yeah.
weird alien boobs because your
Yes.
muscle obviously is very square and rectangular. So that's why you have, a ton of that like fullness and everything
Right.
up here, and the nipples look low.
Mhm.
So obviously as you massage, all that'll change, the
Yes.
muscle swelling and come down. But they look really
And
good.
Mackenzie was showing
Yeah.
me like the difference.
change.
So I was like, okay, that makes me feel better.
Yeah, and because you only have that space in there, so all the implants gonna take up the space
Right.
here, and then as they settle, they're gonna what they
Kinda
call
meet in the
dropping
middle.
and fluffing, and so then that's when like the nipples come up and
Hey.
everything else. But you look awesome; they look perfect.
Post-op, I'm here at my 1 month, so I'm super excited for this appointment in specific, just because that means I can work out, and I am super active usually on a day-to-day basis, so that has been the most difficult thing this past month, was not being able to use my arms as much. So I'm gonna talk to her and ask her about what that activity looks like, what I can do in the process of moving forward. Another thing I'm most excited about is when can I go bra shopping. That is the most important thing, obviously. And I would say one thing I did not expect after the operation was how high they were going to sit and how they were going to look. She calls it the alien boob. So they have settled. Obviously, it's been a month, so now they're starting to feel and look like normal boobs. But I'm feeling really good, and I'm excited to get back into working out.
I'm good. How's everything feeling?
Great.
Can you believe 1 month already?
No, it went by so fast.
Yeah. How's everything feeling?
Really great. I think
Oh, you look good.
the stitching looks good. It's feeling
Really
softer.
nice and soft.
Yeah.
Good. Let's take a look down here. Oh, your incisions are looking perfect.
Yeah.
And down here too.
I can't even see them anymore.
I know they're really good. Are you using the Silogen already?
Yes.
Okay, good. And then how's our massage going? They're feeling
Good.
softer than
Yeah.
they were? Okay, perfect. So remember, obviously, they're gonna have that weird rectangle shape, but as you massage, all this is gonna go down, and then it'll settle and it'll continue to fluff out. So
Awesome.
I saw you in your July 4th bikini.
Everyone was like, I can't believe they look so good that fast. And I was like, me too, because I was nervous
Yeah.
at first.
Well, the shape is still definitely like more oval
Right.
and rectangle, but for how full we went and the muscle and everything, that makes total sense.
And at first I was like, oh, they're getting so small because the swelling went down, and then I like would wear a top and I'm like, no, they're perfect sizes.
I know, it kind of fools you, but also once the volume goes from like up here to down there, then it'll be so different.
I know, I love it. No, I think the sizing we went with was like perfect.
I really like it. Okay, and then you just keep me updated because we won't see each other for 2 months.
Yeah.
So if any issues come up, and then just ease into working out.
Yes, that's what she was saying. But like, I could still like do inclines.
Yeah,
Okay.
totally fine. Just
Arm
listen to your
workouts.
body. Yeah, just listen to your body needs to do it.
We're finally at our 3-month visit. This is my favorite appointment because it's when things have settled. Patients are really enjoying their implants. They're wearing new clothes and showing them off. So I love seeing their final result. It is also a time where I get to just review all of their post-operative care, their scar therapy, their bra support. All of this is so important for long-term maintenance of your implants, and we really focus on this at this visit. Hey, Miss Ashley.
Hi.
Hey.
Good to see you.
How's Miami?
Oh, great.
Amazing.
Mhm.
I get to see all your stuff on social media.
I know,
So,
it's been crazy.
how's this? Everything's going well? No
Yeah,
problems?
no
Mackenzie said everything's perfect.
Yeah.
Okay.
I was telling her like occasional like a shooting thing.
Like a zinger?
Like a zing, and then
Kind of like on the
then
sides
it's fine.
and stuff?
Yeah.
Okay, that'll all go away. Like,
Yeah.
usually takes up to a year for
Yeah.
that to happen.
And then I think one scar's a little still redder than the other, but I'm still using the cream. So.
Okay, perfect. Let's take a look at you
Okay.
and see how everything is, and then we'll clear you to go on and do whatever you need.
Yay. Okay.
Okay, so these look perfect. Any problems at all other than the little zingers that you're having?
No.
They look so good. And I mean, in clothing and all that, I'm so glad we did the boost.
Oh yeah, me too.
So, okay, perfect. Well, you just want to wear really great support.
Okay.
Obviously, underwire, like push-ups, all the things, sleep
Okay.
in something. Work on your scars. They look really tiny and small,
Yeah.
but you can even kind of like massage them a little
Okay.
bit. So work on that up until a year because it'll get really nice and light.
Okay.
And then otherwise, like you can massage from time to
That's
time,
what she was
but they
saying.
feel pretty soft, so I wouldn't worry too much
Okay.
about it either.
Yay.
Okay.
Thank you.
Yay! I'm glad it's all good.
Me too. I would say that my expectations going into it than the actual results after was just far more, I would say, better than what I thought. I didn't know what to think at first, just because you don't know what they're gonna look like. You're shown an implant and not what they're actually gonna look like. And they also feel so much more natural and like they're mine than I would thought. I think I had a little bit of a different experience than most people. I went into it super excited and not nervous at all. I mean, I didn't have to take like the anxiety medicine before. I was just super excited going in, and the recovery process for me, I would say the first 2 days were pretty tough, just because you're not used to that tightness and the feeling of like implants on you. So getting out of bed was really hard for a few days, but once I got used to it, I was back to work in just a couple days. But I would say getting out of bed was probably the hardest thing, and just getting used to that pressure. Since I got the procedure done, I feel like my self-confidence has honestly skyrocketed. I feel so much more confident in my skin, and I just feel like every time I feel better in what I'm wearing. And when you feel good and you look good, it just makes everything better. Post-surgery, I feel like I've done everything that I did before surgery. I'm at my 3 months currently, and I'm back to working out. I'm going swimming in the ocean. I'm doing everything that I normally would. So it really hasn't restricted me or changed much for me. If you're considering a breast augmentation, I would say do what you want to do. Stay true to yourself. If you want to get it done, do it. Because I know a lot of people get in your head and tell you not to do something or wait till you have kids. Like, that's what I was told. But I'm not gonna have kids for a few years. I wanna feel good now. I wanna feel confident, and so I would just say stick to your gut and do what you want. On a scale of 1 to 10, I would say my experience was like a 15. From the second I walked into Dr. Mohan's office, everyone was just so nice, and I felt very heard in what I wanted, and I just felt comfortable, because when you go to a doctor's office, sometimes you don't feel comfortable, and your experience can carry on from that. But following that, I mean, they called me the day of my surgery, the day after my surgery, making sure I was good, refilled all of my medications that I needed to. Like, I needed more Zofran because I was feeling more sick, and they did it immediately. So my experience was just, I say, top notch. All of my friends have asked me where I've got them done, so I'm pretty sure they're gonna be heading your way soon. But my friends, my family, they've all reacted really well, and they see me being a lot happier. So if I'm happy, they're happy.
Perfect.
The hardest part of this whole experience, I would say, is that first 2 days. Like I said, it was just kind of tough for me to get used to that tightness and the heaviness being on, but I would say that's the worst part of it. 2 days is worth me being happy for the rest of my life. And the best part of it is just my clothes fit so much better. I feel like it just fills it out more, and I feel better about myself. I would say to Dr. Mohan, just keep that positivity and being your bright, true self, because that energy, when I walked in the door, I felt it, and I know other girls will too. So that comfortability that you gave me, just keep doing that for others.
So there you have a full look at the entire experience of breast augmentation with us here at Ciaravino Total Beauty. I hope this helped you learn about what the process is like from start to finish, and I can't wait to help you on your journey.